So as you can see, our guest of honor has arrived. Minister Duclos, bienvenue. Vous avez...
Welcome. You missed my bilingual joke.
But I can tell it to you after if you need me to. So it's our distinct honor and pleasure to welcome the Minister of Health. I will introduce our Dr. Peter Vaughan, who's the board chair of Canada Health Infoway, to actually introduce the minister in the next session. Peter Vaughan is a physician, former Deputy Minister of Health in Nova Scotia, former president of the Canadian Medical Association, and as I said, now current chair of Canada Health Infoway. So Peter, over to you to introduce the panel and the fireside chat. Thank you.
Thank you. Merci beaucoup, Sheila.
Thank you, Sheila. It's a pleasure for me to moderate this last session of the first excellent day of our conference.
All get back into the room together. C'est un plaisir pour moi.
It's a pleasure for me today to be here today in person with the Federal Minister of Health, the Honourable Jean-Yves Duclos. Today, we're here for a fireside chat to discuss some warm topics, not too hot.
And seasoned bilingual corporate director from Quebec. I first met José in 2017 when she first joined our board, and I can tell you one thing, Minister, she has good questions. So, and I'll ask the first one. La lettre demanda de Ministre de...
Your mandate letter as Minister of Health declared that we had to strengthen our universal public health system by looking into the full potential of data and digital systems.
J'espère que vous m'entendez.
I hope you can all hear me. I can see you well, and I would like to start by saying that I'm grateful to be here today. I've been wanting to meet you as partners for a long time, and all of those who support Infoway. It's an opportunity for me and a privilege because you may know that I've just come back from a federal provincial conference with my counterparts from the various jurisdictions to discuss the major challenges of COVID-19. And we already knew that our healthcare system had several vulnerabilities, but we also knew that over the next years, these challenges are going to increase with the aging population and with the aging workforce as well. This is a particularly challenging environment, but very exciting one as well, because part of the solutions, not all of them, come from a better usage of science and technologies and data. A few months ago, we announced 5 pillars and 5 key priorities for the healthcare system over the next years. I won't cover them in detail, but they are related to the workforce, reducing backlogs, and increasing access to family physicians through family medicine groups, but also the modernization of our healthcare system. It is mostly focused on the access, use, or improved access, use, and sharing of data. There is a tremendous loss when it comes to the usage of data that may lead to lost lives, inferior health care, or a lack of safe and timely health care. Data can save lives, and we are behind other jurisdictions, but the good news is that we know what to do. And we agree on the importance of doing so. My counterparts last week also agreed, as you all probably do as well. There are challenges, gray clouds, but also blue skies a direction towards several people want to head. And thanks to your leadership and to InfoWay's leadership that we will succeed in the fastest way possible. To come back to what you said, we realized that provinces and territories had the same challenges when it came to virtual care, the improvement of our healthcare system. How do you think pan-Canadian partnerships between provinces, territories, and even with Canadian innovators help us to accelerate the adoption of these technologies? The answer is yes, and the objectives are the following. Once again, these are shared objectives. First of all, in 2022, it is important for healthcare workers, family doctors, their healthcare teams, specialists, nurses, labs, paramedics, pharmacists. All of these stakeholders have to share fundamental and necessary information to care for patients. We are once again in 2022, and people have the right to access their health information. We have access to a ton of information that isn't relevant for us, but not to our own information. Information that has a direct impact on our lives. And a third of Canadians, as we speak, can access to their own health information and information that is reusable as well. The third thing is to connect patients with providers, especially in remote communities or marginalized groups. In 2022 in Canada, as we all know, there are a lot of inequities. The fourth objective is to use science and data to improve our knowledge on the efficiency of important things like immunization and COVID-19. We had a lot of challenges, just like other countries, on vaccination, treatments, equipment. We have to use information in Canada, once again, to facilitate access to better health care. The last objective is to ensure more transparency and to foster trust in our scientific and collective progress. When people only hear negative things on healthcare because the only thing is here that it's costing more money and the only thing they see are more problems, more backlogs, less access to family doctors or mental health care, more backlogs in surgery or long-term health care, they are frustrated when they hear all of this and think that things aren't working. So why should we keep trusting the system? And why should we keep having a universal, accessible healthcare system that covers the whole population and that is transferable? Because that's an essential condition of the Canada Healthcare Act. I'm going beyond your question, but transferability is not only a question within the provinces to have the necessary information to treat people, but also to ensure transferability between jurisdictions. So when I'm treated in Montreal and my doctor says that I have to go through the same tests and diagnosis that may take days and weeks and cost more money, in the meantime they can't treat me just because I'm from Quebec City, but now I'm in Montreal and they don't have the necessary information. That's a transferability and quality of care problem. What you're describing here is interoperability, and that's a topic we discussed today. And that is one of our focuses. There are challenges and barriers to adoption because progress is there, but we're all here concerned by interoperability, data usage, and virtual care because we do want to improve the system. Can InfoWay play a role to reduce these barriers How can we leverage past success by disseminating technologies to accelerate this? InfoWay can do at least three things. From a technology perspective, interoperability is a very important aspect. It is one of the major technology initiatives that can facilitate the collection, usage, and sharing of data. InfoWay can also improve the culture. Technology is one thing, but there needs to be a change of culture. Culture has to change from a medical perspective in our clinical settings with researchers, but also in private corporations that will play a bigger role in the way technology can be used to leverage data. InfoWay can also do what you're doing today, is telling all Canadians and the population of Quebec that collective work within a federation is important. In Quebec, we represent 22 or 23% of the Canadian population, but the quality of our treatment and drugs, including the quality of management and the administration of our healthcare system, all of that can be improved if we share information data throughout the country. So it's a tremendous opportunity to be part of a federation. We have to eliminate silos between provinces and territories, which everybody can benefit from. I think interoperability is an important pillar, but the major crisis we're going through for our healthcare workers is another shared challenge between provinces and territories. We could use technologies for the human health resource crisis. The Canadian government can also contribute to reducing the shortage of workers. How do you see a partnership from this perspective between provinces and territories to reduce this shortage of labor and all of those challenges? The Canadian government has different roles. I'm not a minister of healthcare, but a minister of health. It's not only about hospitals, but also promoting health, prevention, and protection. 80% of my work is based on these elements, which is also the work of provincial health ministers to make sure that people don't have to go to the hospital in the first place, that they can see a physician beforehand. That's 80% of our work. 20% of the rest of the work isn't necessarily the responsibility of, or only the responsibility of the health minister. We're also here to help our colleagues from the provincial and territorial health departments. Managing pandemics and crises isn't easy. I'm here to help them. From a political perspective, I'm not here to be an ally of the financial ministers. I'm not here to send unconditional transfers that they can use whichever way they want to. I understand that that's what they want, but I want to help the health ministers from the provinces and territories. When it comes to labor, the problem is the same throughout the country. It's related to an aging population, but also an aging workforce, because the demographic curve is reversed these days. A lot of people are coming closer to the age of retirement. Some people took an anticipated retirement or changed careers because they didn't want to work in the healthcare system anymore with all the pressure and stress it comes with. Some people got sick, and some of them developed long COVID. Some are in burnout. And the pressure on healthcare workers is tremendous. So how can we use technology and InfoWay to reduce this pressure? First of all, one of the major sources of stress for healthcare workers is that they don't access information in real time. They don't have the tools necessary to treat patients properly. They're afraid of making mistakes, forgetting something, not treating patients in the right order of priority. The second thing is that there's a lot of red tape, a lot of paperwork, photocopies, faxes, and that adds to the stress of these workers. The third thing is their professional environment and teamwork. There's a lot of silos within medical teams, which can have a negative impact on morale and even create tensions between the medical teams. Tensions wouldn't be so acute if there was more adequate distribution of work between these teams. Workers are also worried about the future of their profession. It's true for nurses, but others as well. Young nurses who are coming into the profession leave the profession only a few months later, or might go to work for private agencies because these young nurses aren't getting the support of their senior peers who often left the profession or don't even have time for mentoring or supporting these young professionals at a critical time. Even after having worked for a long time in the system, they leave the profession, and it can be a personal tragedy for nurses and for their peers. Infoway could help by working with, or Kai can also contribute by better planning the future of our healthcare workers. Statistics Canada can also help. Canada's somewhat behind when it comes to planning future needs, and now we realize that we don't have enough skilled labor. This takes planning. We have to invest more. I know it's a long-winded response, but I'll end by saying that this is a planetary crisis, not only in Canada, where there's a 20 to 30% shortage of staff in the healthcare system, but by 2030, another 20% will add because the population and workforce is aging. 30 plus 20 is 50%, which means that we have to act fast with technology, data, planning future needs, and having the proper resources to meet these challenges.
Okay, what we're saying is there needs to be a lot of changes.
Well, we've been talking about change for a long time. If we look around internationally, the places that have made significant progress have made some legislative demands, you might say, on the system. CMS in the United States saying, you must, the payer must do these things to be able to participate. That generated a lot of support for standards, for example. The Europeans doing similar kinds of things. Do you see that kind of possibility in Canada with the pan-Canadian structure that we have? The ability to overlay in the Canadian context some legislative foundation that would allow for the ultimate utility that all the good things you've talked about, but to make that happen, there needs to be a framework, there needs to be a pipeline, there needs to be a way to tie these pieces together, and maybe that's what's missing in the 21st century, since much of our legislative foundation is 19th century. So do you see that?
The answer is yes. I do see that, and we'll find a way to make that happen. Because markets are not perfect. There are market imperfections in Canada, which limit the progress around, again, the use of data. Yes, we have a federation. It's great. We have different experiments, different people trying different things. They can therefore learn things sometimes more quickly than if we had a unitary system. But a federation also brings imperfections. And one of these imperfections is the fact that there is not enough coordination in how we need to move forward. Both in terms of developing the technology, changing the culture, and sharing the data, and therefore the science around health. So there is a clear agenda that many have pointed to, and you're very mindful of that, and many others in this room, I believe, will also know about that, including a data charter, being stewards of data as opposed to being custodians of data. So doing this in the proper way to ensure that privacy, confidentiality, that's all dealt with, but also mindful of the fact that there should be a right for people to access their health information. There should be a right for providers to have access to that information when it comes to protecting the health and the lives of those people. And in Canada, I would argue, based on what I hear, that we're failing in that regard in many different ways.
So we're optimistic then that we can make this, we can weave this web that ties together the intention to have access to information that people have been wanting for a long time, and it takes that leadership, Minister, to make that happen. So I think we're all very excited to hear you say that.
Leadership and partnership, because however goodwill we may be individually, we know that progress is made collectively. So that's why one of my main lessons, my main messages today is that we will need everyone's leadership and everyone's partnership. We have in this room tremendous people, knowledgeable, intelligent, and connected, who will need to speak up in the next while when it comes to building this agenda, which we might have started some time ago, and which we did start some time ago, but which we need to accelerate now because of exactly the thing that you mentioned.
En fait, ce que vous abordez,
What you're talking about is the importance of having innovative solutions for these challenges and to implement the necessary changes. With diversity in Canada, we can find the best solutions, and how can we leverage this diversity, these various experiences and perspectives to find shared solutions that will accelerate the scaling up of these technologies, to find solutions for Canadians that will lead to an accessible healthcare system and a fair healthcare system. I'm like Peter, I'm optimistic because we have several people who are working hard, learning best practices, sharing, and as you said, partnerships and collaboration are key to success. I fully agree with you, and I'm a scientist. My background is in science. I didn't have the opportunity to work in the health sciences field, but I'm an economist, which is another form of science. In my former life, I liaised between health care and economics through demographics. In 2022, we have the opportunity to access new technologies, forms of data that we can use to foster trust and to be more optimistic, if I may. There is a lot of disinformation, misinformation in Canada when it comes to science, including from scientists themselves. Unfortunately, that's the nature of things. Some people intentionally or unintentionally spread misinformation, which which makes people skeptical and at times even aggressive with regard to the role of scientists in our society. We have to demonstrate to Canadians that data researchers, scientists, research can improve their quality of life, including the healthcare they receive when they need it, which will be an added value and act as a beacon when people will look at climate change and other social crises that we can experience.
Bonnes données et plus que des
This is also based in quality data and people's belief in this data. I think that's an excellent message to leave on. And to show progress, I think we need to celebrate success stories and progress. In Canada, we've spoken a great deal about the crisis and the problems we've had, but there has been major advances accomplished. There are new hospitals, after all. We have new technologies. So sometimes I think it's important to also speak about our successes.
I'm just going to say that thank you. We're unfortunately out of time, so thank you very much, Minister and Jose, for your excellent conversation. The fire was warm, as I promised, but not too hot. So thank you again for your time. I think we've all benefited very much from hearing directly from you what your ideas are and what your thinking is around how we can really create the health system in Canada that people expect us to, and people want to and need to in this crisis that we're facing today. So thank you very much for the time you spent with us today. Merci beaucoup.
I think that was a great way to close day one of the conference, and I think leadership and partnership are two words that will resonate well and really underscored some of the things that we talked about today. Je vous rappelle qu'on a une réception de 5 à 7 Industry.
We have a 5 to 7 networking event in the fortifications room
On the
9th floor.
morning. The breakfast sessions, there are 3 of them. They are starting at 7:30 a.m. and we will start here at 8:45 tomorrow morning. And I just want to say also that the reception is sponsored by Onomar Strategies. So thank you in advance to you. And we get to eat and drink some more. So on te verra sur la salle Fortifications 9e.
So fortifications room, 9th floor, please. Thank you.